Today, we're discussing how to treat a gummy smile. Hi guys, my name is Dr Sarah Tonks. I'm a cosmetic physician in London. Today I'm going to be discussing with you the various different methods we can use in order to treat a gummy smile. Now, first of all, it goes without saying that the most comprehensive and complete way to treat a gummy smile, if the indication is severe enough, is actually with surgery. So there's a type of surgery that one can do which basically moves the bone that the teeth sit in into a slightly different position, and it changes the plane at which the teeth sit. Now, if your gummy smile is not severe enough to undergo surgery like this, then it might be appropriate to try and use Botox and dermal fillers in order to disguise that. The other thing to mention about gummy smiles is it's important to check the length of the teeth. For example, if the teeth themselves look very, very short, then in some cases, crown lengthening surgery can be performed on the gums in order to make the gum itself appear smaller and the tooth longer, without changing the structural underlying position of the teeth. So there are a few things that we need to check before knowing which is the best treatment to perform. You need to check the underlying bone structure, the shape and length of the tooth, and any associated muscle pull. Say surgery is out for you and crown lengthening surgery is out for you or not appropriate. The other available options, being Botox and dermal filler, can be used in a variety of different ways. Let's go over to our patient today and do a facial assessment in order to see what treatment we're going to perform. On this first image, she's not smiling. The more astute amongst you may have guessed that. You know, in my videos, I don't just like to treat one thing. So I'm going to do a full facial assessment for her first, and then we'll have a look at her smiling. So you can see here that her lower facial third is really short, and she's actually really using her chin muscles and her lip muscles to try and close her bite. This is due to the position of the teeth and underlying bone structure. You can see here there's some dimpling on the chin, and that's because she's trying really hard to form this seal on her lips. The next thing that I notice is the cheekbone. So she's kind of flat here, and it would be nice to just get a little bit more of a vector here so that the face is in more of a V shape. So you can imagine if we extend the chin down and we vector the cheekbone up more, well, it just looks nicer, doesn't it? Can you see how there's this downwards droop as well in the eyebrow and also in the eyelid? Ideally, I would like to put a bit of Botox there in order to lift up the outer corner of the brow. I don't think we did that on her actually. And it might be quite nice to put a bit of filler there as well in order to push the outer edge of the brow up. Ideally, it'd be nice to put a bit of Botox in the brow to lift the outer edge up, and also some filler here to push the lateral edge of the eye up. I don't think we did that. So let's look at her smiling. Yeah, we can see there a reasonable amount of gum show. So I think it's fair to say that you wouldn't be able to make the crown, so the bit that's visible of the teeth, longer without it looking weird. Your other options would be to drop the upper lip so that on smiling, the muscle isn't pulling the lip up as much, or do something surgical. Okay, so the first thing we did was use some Teocal Ultimate in the cheek area. So I went to the front part of the cheek and also the lateral part. I then used Teocal Ultra Deep in the cheek area, and then used a cannula to go in from the left side of the chin to the chin point and the marionette region. I don't know if you could see on the pre-existing photos, but the left side was actually much worse than the right. So I put a whole couple of syringes actually in this region alone. And then by that time we'd used 4 mils. So let's have a look at how this looks. So you can see that already the cheekbone is looking a little better. From doing this, the outer corner of the eye has been pushed up slightly, which is good. It means that you can't see as much of the white underneath the coloured part of the eye. And the chin has been extended down. So that's 4 mils, looking pretty good. Then I used Radiesse 0.75 mils per side to create what's called the next top model look. I find that a bit cheesy, but nevertheless, that is what people are calling it. So that is what I did. And then I used TSL Kiss in the lips. You could probably see that there was some asymmetry in the lip. So the left side was much bigger than the right. So I used the Kiss in the right lateral lip and along the border, and then upper lip tenting on the right and a little bit on the left. I then used a wee bit of it in the lower lip as well. There's some asymmetry in the lower lip, with the most fullness being to the left part of the lower lip. So we tried to centralize that. And the last thing was to use the Botox in there. Now, when I do these injections using Botox, I'm kind of really cautious because it's sometimes uncomfortable for people when it starts to kick in and it changes the way that their face moves, obviously, because that's what it's supposed to do. But I find that sometimes people prefer it if it's carried out over more than one session. So I only saw her once. So I was very cautious with the amount that I put in. Anyway, let's have a look at how she looked after she'd had all the filler done. And this is her immediately. I do know between her having this filler done and now, she did experience quite a bit of bruising. So this is her after 3 weeks. Cheekbones are looking good. I think the chin has really sort of come into its own there. I think that looks really nice. It's really extended the vertical dimension of the lower facial third. And the fullest part of the lower lip is now much more centralized. I think it looks much better. You could make the argument for adding more filler in the upper lip. Personally, I think it's enough. I would leave that one up to the patient. But let's take a look at her smiling. And as I mentioned to you, I was quite cautious when putting the Botox in. If I could see her again, I would definitely put more. I didn't see her in the interim, so there was no opportunity for adjustment. The toxin in the chin, however, has worked really well. You see that there is much less muscle pull in the chin, and now she's really not fighting to relax that muscle on smiling. It just looks a lot more harmonious. And that's actually an interesting point, guys, because often people will ask, well, if I get my cheeks filled, does it mean that I'm going to look weird when I'm smiling? And as you can see, she's smiling and she looks normal. So I guess the answer for her would definitely be no. Just FYI, another way to use filler to drop down the lip when smiling is to place it at the base of the nose, so right here. And sometimes that will cause a physical blockade so that the muscle isn't able to contract up as much. So it means that the lip, when smiling, will be slightly lower. Normally I like to do a combination of doing that with a bit of Botox, but for her it wasn't really appropriate, so I left it where it was. Okay guys, so that's it for today. I hope you enjoyed the video. If you have any questions about the procedures you've just seen, please just let me know in the comment section below, and start the chat as well if you've ever had a gummy smile and perhaps you've had Botox or fillers or maybe even surgery. Join me again next week where we will be talking about another case, and in the meantime, it'd be super if you would subscribe to the channel and like the video. I'll see you later.